multiple sclerosis, attention deficit disorder, degenerative diseases, diabetes, fatigue, cardiovascular diseases, fibromyalgia, impotence, depression, lack of energy, overweight, rheumatism, short-term memory loss. Is there any hope?
My name is Dennis Harper. I'm a physician and I've been practicing medicine for approximately 9 years. During this period of time, I treated my patients with the drugs that I was taught to use, and found that many times my patients were coming back because they were having either side effects with the drugs or because they were not getting the results that I anticipated that they would. Consequently, because of this, I started using alternative methods to treat my patients. Now, in this particular area, there's a whole new class of nutrients called phytonutrients. Within this class of phytonutrients, there is also a specialized class called bioflavonoids. Paranthocyanidins were originally classified as a bioflavonoid, and because of their uniqueness were then spun off and became a separate class of phytonutrients. The paranthocyanidins are an extremely powerful antioxidant. They are approximately 50 times more powerful than vitamin E. They're 20 times more powerful than vitamin C. They stay in the body for approximately 72 hours, giving sustained antioxidant effects. We have seen with the use of the paranthocyanidins changes in live blood cell analysis using dark field microscopy, and in as little as 20 to 40 minutes we've seen a change where before the cells would be stacked on top of each other, something called rouleau stacking, and 20 to 40 minutes after using the phytonutrients, the paranthocyanidins and some enzymes, we saw complete dissolution where they were then completely separate.
This is a live blood cell screen using the dark field microscope. The portion that we are looking at is prior to taking the oligomeric proanthocyanidins, or more commonly known as OPCs. We see here small white blood cells trapped in what is known as erythrocyte aggregation, or more commonly known as blood sludge. The primary cause of this condition is high fat and protein in the blood. This condition can lead to poor circulation and cardiovascular disease. This is a uric acid crystal resulting from high concentration of uric acid found in the blood. Uric acid crystals can cause joint pain and inflammation. This can also lead to the onset of arthritis and other degenerative diseases of the bone and joints. Uric acid crystals are also the leading cause of gout, a very painful joint condition. This is a cholesterol crystal identified by lack of color. The principal cause of this condition is poor assimilation of fats and proteins, which in turn is caused by the body's inability to digest the fats and proteins. This can be a leading factor in plaque accumulation in the cardiovascular system, resulting in poor circulation and the potential for stroke and heart attack. The small black lines found here are liver spicules, or fibers which form in response to liver stress and congestion. This can be caused by toxins such as antibiotics, drugs, alcohol, tobacco, and environmental pollution. This condition can lead to autoimmune associated diseases such as fibromyalgia, multiple sclerosis, and chronic fatigue. This is hemolysis, or dying red blood cells, often due to poor nutrients and poor digestion of food. This also is due to low levels of antioxidants in the bloodstream, resulting in fatigue and low levels of energy. Here you can see yeast or fungus. This is caused by undigested food particles, especially in foods that are high in sugar or white flour. We can trace infections of all sorts to this condition. This is a classic poikilocytosis, or more commonly known as free radical damage. The leading causes of this condition are environmental toxins in the food, water, and air, such as pesticides, food additives, radiation, chemotherapy, preservatives, drugs, chemical fumes, and exhaust from cars, to name just a few things contributing to the low levels of antioxidants in the bloodstream and higher free radical damage, resulting in the acceleration of the aging process. This condition can lead to accelerated aging and early onset of degenerative diseases. Genetic damage and mutation to the DNA is one of the major concerns with this condition. This is a live blood cell sample taken after taking the oligomeric proanthocyanidins, or OPCs. Notice now that instead of the red blood cells being stuck and stacked together, separation is almost completed. Many now are round and free-flowing. In this condition, they now have the ability to be oxygenated and more mobile, thus enhancing greatly the circulation to all parts of the body, such as the brain, vital organs, and providing more oxygen and nutrients for the muscle tissue, which is especially important for athletes or anyone working out or exercising. Notice the cell's ability to separate in just a few minutes. The condition continues to improve with additional time, and especially with the continued use of oligomeric proanthocyanidins. Amazingly, the white blood cells have the ability to double or triple in size once the undigested protein in the cell receptors have been resolved, thus allowing the white blood cells to function properly. The white blood cells here is at work cleansing the blood. You can see it resolving a fibrostolic parasitic colony. This is a cholesterol crystal being dissolved and will now be small enough to be filtered by the kidneys and excreted from the body, whereas before they were too large for filtration, thus greatly reducing the potential of plaque accumulation and advanced cardiovascular disease. Again, notice the free-flowing red blood cells. Utilizing the dark field microscope, we can now scientifically show the dramatic increase in the nutritional health of the blood and its ability to function at a much better level within just a few minutes after taking the oligomeric proanthocyanidins. You can see how freely the blood cells can flow with the increased oxygen and nutrients. Especially notice the absence of yeast, liver spicules, hemolysis, or dying red blood cells. We have reduction in bacteria, cholesterol crystals, blood sludge, and plaque, helping the body reverse arteriosclerosis. Gone is almost all evidence of free radical damage, thus strengthening the cardiovascular system and improving blood vessel health and circulation. Thanks to these new exciting phytochemical supplements such as the family of oligomeric proanthocyanidins, we can now visually see how these are dramatically changing the way we can enhance the nutritional health of the blood and therefore our overall health, thus helping us to slow, stop, or reverse the aging process. We find dramatic improvement in the condition of the DNA, the building blocks of the entire body, changes that can take place overnight or with continued use over a prolonged period of time depending upon the individual. We now possess the ability to actually grow younger with proper nutritional supplementation and especially using the oligomeric proanthocyanidins.
So we can tell in very short period of time that the phytonutrients, including the proanthocyanidins, are extremely important to a person's well-being. This particular class of bioflavonoids, the proanthocyanidins, are very bioavailable. That's one of the unique parts of the proanthocyanidins. They tend to be almost 85 to 95% absorbed just by taking them orally, whereas with the other bioflavonoids, they're extremely difficult to absorb. Sometimes you only have 5 to 10% bioavailability. Would like to explain now as to the reason why these proanthocyanidins actually work this well. They are an extremely powerful antioxidant. They're 50 times more powerful than vitamin E. They're 20 times more powerful than vitamin C. And you might say, well, what is an antioxidant? Well, an antioxidant is something that fights against something called a free radical. Now, you say, what is a free radical? A free radical is an atom that has an unpaired outer electron shell. Now, atoms generally will tend to have at least paired electrons that will circle around their outer shell. When one of them is missing, it becomes unstable, and consequently it actually kind of reaches out and says, I'm going to grab yours. And as it grabs somebody else's electron, it then becomes a paired electron, but the other one then, of course, becomes unpaired. And so consequently, one free radical starts something called a free radical cascade, which means that one free radical taking from another atom can create millions of free radicals. Fortunately, our bodies are designed to help with the free radical cascade, and that's where the antioxidants are becoming so important. Where do we get these free radicals? Well, they come from three places. They come from inside ourselves, from biochemical reactions, they come from the environment, and they also come from free radical cascades, which I just mentioned. Now, when I talk about the environment, I'd like for you to understand a little bit about the environment. We're talking about pesticides, we're talking about herbicides, we're talking about automobile emissions, we're talking about sunlight, we're talking about a whole host of things that are out there that are trying to destroy us. There are other things other than what's being dumped into the environment. For example, when we walk out into the sunlight, what do we see? We have ultraviolet radiation that comes down and beats upon our skin and consequently causes free radicals to damage the very skin that we're wearing. And by so doing it, you've heard of skin cancer. Certainly those are caused by free radicals and by the ultraviolet radiation damage. As it damages those tissues, you start having burning. All of you have experienced sunburns. That's from the free radicals. It's very similar to any other type of a fire. The hotter the heat or the more free radicals that are being released, the more damage you're going to have. First degree, second degree, third degree burns. All happen with free radical damage. The way free radicals damage our cells is each cell has its own little individual markers on the outside, which genetically allow the body to determine that it's part of itself. So it has these little proteins that kind of stick out on the cell membrane. The membrane itself is also composed of a lipid bilayer, which kind of looks like this, where it likes the water on the outside and it likes the fat on the inside. And then inside the cell you have a round or a nucleus that has a nuclear membrane as well as DNA particles on the inside of the nucleus. The free radicals can damage any one or all of these parts of this particular cell. It can take the proteins off the surface of the membrane to where the body no longer recognizes a cell. It can destroy the lipid bilayer to where it actually glues it shut, to where nothing can then penetrate through the membrane and get into the cell to nourish the cell. It can open holes in the membrane and allow the cytoplasm inside the cells to leak out, as well as to have bacteria and viruses leak in, causing cellular death. Or it can go in and it can rupture the nuclear membrane, create havoc with the DNA genetic particles there, consequently creating mutations. And by so damaging these cells, then we see all kinds of things taking place in our bodies. For example, arthritis. Down here, for example, in your knee, we have synovial membranes there that have synovial fluid inside of them. If those membranes start to becoming injured, they will start leaking synovial fluid, which causes compression on that joint. Consequently, you start having more inflammation. That inflammation, in turn, brings in more cellular debris, trying to fix the damage and creates more inflammation. We also see the problems associated with the eye. I talked about the sunlight. If you're looking at our eyes, the intraocular space of our eyes is filled with fluid. That particular fluid is loaded with antioxidants. The reason why it's loaded with antioxidants is because it's being barraged with ultraviolet radiation all the time. So consequently, with the use of the antioxidants, it prevents our vision from deteriorating. Consequently, using the paranthocyanidins or the antioxidants will, as far as I'm concerned, help prolong any visual disturbance or keep us from having any visual disturbances for a much longer period of time than we would normally have had. We've also seen problems associated with cancer. All of us know what cancer is. You know somebody that has cancer. I know somebody that has cancer. If you don't, you will, because the cancer rates have gone up very, very sharply from 1 in 10 up to 1 in 3 now, and very shortly, who knows, in a few more years, you're going to be looking at 1 in 2. And this all has a very great deal to do with the free radicals and the free radical damage that takes place and the lack of antioxidants, not only in our food, but in our environment as well. Our hearts are also damaged by free radicals. How are they damaged? Well, we have blood that goes through our hearts, and that blood carries oxygen, as well as other things that produce free radicals. Those free radicals, in turn, damage the cells that are on the inside of the arterial wall, creating something called plaque. That plaque is actually like a little Band-Aid that tries to cover up the damage, and it attracts other cells, and pretty soon you have a little clumping that takes place. And the more free radical damage that takes place, the thicker that clump becomes, and it starts bringing cholesterol in there, which is also a residue of some of the cells that are damaged. Now, cholesterol is both good and bad. You've heard of HDL cholesterol, you've heard of LDL cholesterol. HDL cholesterol is one of our antioxidant systems. When HDL levels are oxidized, or our HDL cholesterol is oxidized, it actually turns into an LDL, which becomes bad cholesterol. So once again, we see oxidating materials, the free radicals, creating havoc inside of our body. We as human beings are some of the longest living mammals in the world. Have you ever wondered why? Well, there was one particular paper where they took a look and wanted to find out why. So they looked at the concentrations of the antioxidants that were present in different mammals. And they found that it directly correlated with the length of their lives. The more antioxidants they found in a mammal, the longer that particular mammal lived. Now, we as human beings had the highest level of antioxidants in our bodies, and consequently, we tend to live the longest. So is it unreasonable to assume that if we're using additional antioxidants like proanthocyanidin, that we will not increase our longevity? We should be able to live 120 years from many studies that have been reported. Not many of us are. And the reason because of that is that we're filling our bodies with free radicals and we don't have the proper antioxidants to take care of them. The proanthocyanidins make very good sense to me to use as an anti-aging property. Now, I'm speaking as my own opinion on this, but it makes very, very good sense. As a matter of fact, another physician, a Dr. Denham Harmon, in the 1950s, proposed his theory of aging was built upon free radical related diseases, and that free radicals caused aging. Now, we're just now starting to see that perhaps that's true. It's been 40 years in the making, 40 years for us to finally figure out that maybe Denham Harmon really knew what he was talking about, but we're seeing over 200 papers each month being released about free radicals and the effects of the antioxidants, not only on prolonging life, but prolonging and postponing disease and disease states. I strongly suggest that you start looking at proanthocyanidins as a way of augmenting your own personal health. I think it's very important that you start reading and learning more about how to keep your body healthy, because if you depend on physicians to do this, I believe you're going to be sadly disappointed. We physicians treat disease. We do not treat wellness. If you wish to remain healthy, start studying for yourself. Start using these phytonutrients, of which proanthocyanidin is one of the most powerful. Read for yourself, use the proanthocyanidin. It's time to take a look. It's time to open up your mind and be able to receive additional information concerning your ability to maintain your own health. I would hope that at this time that you would pay strict attention to these people who have been trying the proanthocyanidins and listen to the results that they have gotten.
A year ago, I went to the doctor for a routine pap smear, and the doctor's office called back, and I had a condition that was abnormal, and it was called dysplasia, and the degree of it was moderate to severe. If you're not familiar with what dysplasia is, it's an abnormality of the cells, precancerous, and it usually is on the cervix. The doctor sent me to a gynecologist and said, the gynecologist gave me a biopsy, and the biopsy got sent off to a lab, and when it came back, it confirmed the results, moderate to severe dysplasia. I had a consultation with the doctor, and he said that he recommended that I have an operation called a conectomy that would remove all these cells plus a rim of normal cells around it to make sure that he got it all. And he stressed that cervical cancer was really deadly and very aggressive, and I didn't want to mess with it. And in my case, because it was severe, he thought that I should have this particular type of surgery. I went ahead and had that and went along on my merry way, and 3 months later I had to go get a follow-up pap smear. So I went for the pap smear, and he called, and he had some bad news. The dysplasia had returned in a moderate to severe form again. I was very upset about this. I had a lot of cancer in the family. I've also had a problem with my immune system for the last 20 years, which made it much more likely that I was going to have a reoccurrence or problems. At that point, he recommended that I have my cervix and uterus removed. And my other doctor said to do it quickly. Both of them really emphasized how terrible this was and that I should do it soon. So I did schedule the operation for 6 weeks from then. And in 2 weeks, my husband and I ran into an old friend that we hadn't seen in years, and he told us about a product, a supplement called OPC, which was a bioflavonoid, all natural. And a lot of his friends and family had taken this supplement and recovered from really devastating diseases. He talked about somebody that had fibromyalgia, osteoporosis, a stroke, and leukemia, and hepatitis C. and it had varying degrees of improvement and sometimes huge and complete turnarounds. I just thought it sounded too good to be true, but I really trusted this man. I'd known him for a long time, and I didn't know him to be an exaggerator or a liar, so I tried it. I went and bought the OPC and another supplement, and I started taking it. The operation was getting closer, and I was getting calls from the office that I should order my painkillers, IV painkillers, because I was going to be home shortly after the surgery. And I just was not sleeping at night and not feeling good about the whole situation. So I called the doctor, and I told him what I was doing and told him I wanted to give these supplements a chance, and asked him how dangerous it would be to wait a month. He said a month would be okay, but don't wait 3 months. He wouldn't recommend it. So I took the OPC for the next 4 weeks. So for a total of 6 weeks, I took these supplements. I went back for the biopsy, and I got a call within a week from the doctor, and he left a message. The other times that he had left a message, I never wanted to call him back. My husband had to prod me to, because he'd just say, "This is Dr. So-and-so, and I need you to call me," and it didn't sound good. But this time he said, "Jean, I've got good news. You need to call me." Oh, my heart leapt when he said that. So I dialed the phone quickly, and I asked him, and he said, when he answered the phone, he said, "I'm baffled, but I'm pleased. The dysplasia is gone, and you no longer need the surgery." I was so happy and excited, and now I'm going on vacation in 2 weeks, and I'm going to a family reunion. Instead of using my vacation strapped to an IV bag, I can tell you I'm really going to enjoy this family reunion much more than you can imagine, because I'm so grateful that I didn't end up in that other situation. The other difficulties that I have had with my health and my immune system, I see an improvement, and I'm also very encouraged that my immune system will continue to strengthen, and that I feel I've got a hedge against cancer. When I first had the diagnosis, I felt utterly powerless. I said, my cells have gone wacky, I eat pretty good, I sleep at night, what else can I do? And now I really feel like I've got more tools in my arsenal to keep myself well and to keep myself going stronger.
Hi, I'm Pam Corlett, and I'd like to share with you some information about OPCs. I started on the products myself last fall. I have had cancer, which resulted in 5 surgeries in a 9-month period of time. Shortly after, I was diagnosed with fibromyalgia. Since starting OPCs, I really feel like I have gotten a lot more energy. I am no longer taking any medication for fibromyalgia. Even though I still have some symptoms, they are much more tolerable. Because of this and my experience with OPCs, it got me to a point where I tried my son, Chris Klein. My son has ADHD and OCD, and right now I'd like to talk to a lot of the parents out there. If you have a child or know of a friend or even an adult who has ADHD or OCD, you know how it can impact their life. Even though this is not life-threatening, it does make a major difference in their life every day and everybody around them. My son was having 4 and 5 panic attacks a day. We were living from one homework assignment to the next because of his compulsion to be perfect, because of his hard time in staying focused and doing the work. He's a very bright, very talented young man who wants desperately to do very well and has high dreams and aspirations for himself. But these disorders were getting in the way. We started him on Ritalin about 4 years ago. 2 weeks into the Ritalin, he started developing personality changes, became very aggravated, and in 2 weeks became so depressed, my son wanted to die. Obviously, we had to stop the medication. It was hard enough for us to get to a point of giving my son the medication, but it became clear after dealing with like 3 or 4 different doctors that he needed some kind of support. Well, this sent us on a search of trying to find a medication that would help Chris and give him the support that he needed. And unfortunately, there was not a medication out there that he could take that didn't have adverse side effects. By taking the OPCs, the thing to me that's so amazing, and I hope a lot of you parents can identify with, when you have to make a decision about putting your child on medication, there's a lot of fears involved with what the side effects are, how much testing has been done on children. It can, like Ritalin, it can stunt the growth, reduced appetite, and the other one that I did not know was depression. OPCs has no side effects. To see my son have his life back where he can concentrate enough to get his homework done. No, it's not a cure. He still has ADHD and he still has OCD, but they're manageable. He is a very happy child. He's doing very well.
Hello, my name is Chris Klein. I'm 13 years old, and I would like to share with you how OPCs has impacted my life. In my opinion, patients are the real experts of how they feel and what can make them feel better. I've been diagnosed with ADHD and OCD, which has made my life very stressful. ADHD is like living in a fast-paced kaleidoscope where your thoughts, images, and sounds are constantly shifting, which makes my life very confusing and stressful. OCD constantly makes my mind feel like everything that I do has to be perfect, which makes it very difficult for myself to complete tasks in a timely fashion and makes me lose a lot of sleep. To treat these disorders, if you will, I've been trying a lot of medications, including Ritalin, starting off in Ritalin, and ending on Lovox. However, I've had there's side effects to each one of those medications that I've been tried on. Since then, my mom has asked doctors if it would be okay if I tried OPCs to help with my disorders. They said yes. Since then, I haven't had any panic attacks. I do my homework in 2 hours instead of 7, and I haven't had to use my inhaler or any other allergy medications that I had to in the past. Since now, I think I have my life back. Personally, I give a big thumbs up to OPCs.
My name is Athena, and I'm 12 years old, and from when I was 4 to 9 years old, I was experiencing symptoms that doctors could not put a name to. I was visiting many doctors at many times in many places. When I was 9 years old, I was taking many pain medications and muscle relaxers just to be able to walk. I was taking aspirins 24 hours a day and visiting the doctors 3 or 4 times a week, and I was lucky if I could complete 1 day of school a week. My parents got me into the NIH to see 5 top specialists for 3 days. They diagnosed me with the disease of fibromyalgia. I had no idea what it was, so I asked them, and they said that basically I would be experiencing the pain and I should try to ignore it, and they gave me stronger medications, which just made me sick. I could no longer do anything fun. I couldn't jump on a trampoline, I couldn't walk, I couldn't run, I couldn't skate, or anything like that. 9 months later, we went back to the specialists, and they said that I was stable, even though I didn't feel any better. 3 weeks later, I started taking OPC, and within 3 weeks, I felt better. I could do sports, I could run, I could play outside, I could jump on a trampoline, I could skate. I could do anything, and now I've taken the sports of basketball, volleyball, softball, and soccer. I used to have to wear glasses, and now, since the OPC has improved my eyesight, I don't have to wear them anymore.
My name is Patty. I'm 39 years old, and I've been an insulin-dependent diabetic for 21 years. About 12 years ago, I was diagnosed with diabetic retinopathy, which is when there's bleeding in the back of the eye. Left untreated, it can lead to blindness. There was an area in the back of my eye that they performed laser surgery on, which corrected the bleeding, but unfortunately left me with a minor permanent loss in vision. About 5 years ago, they discovered another area in the back of my eye that was bleeding. This time it was very close to the center of my eye, and they couldn't perform the laser surgery on it. If anything were to go wrong with the laser surgery, the risk of me being permanently blinded was too great for them to be able to take the chance. So instead, the ophthalmologist decided to keep watch on that section of my eye until the risk of going blind from the retinopathy exceeded the possible risk of going blind from the laser surgery, and then we would perform the laser surgery. Over the past 5 years, a few other minor areas have popped up with the retinopathy in that eye and also in my other eye. About a year ago, I also started having problems with my right leg and hip. I was having numbness and tingling in my leg and hip, and went to my doctor, and he performed a series of tests, an MRI, a nerve study, suggested painkillers, physical therapy, exercise, and nothing relieved the symptoms. The best thing that he could do was to prescribe me painkillers to help alleviate the discomfort that I was having. And that's a very typical course of treatment for diabetics. There just isn't much that they can do. In June, I was complaining to a friend of mine that I was having trouble remembering little things in short-term memory, and it suggested to me to try a product that uses OPCs. And the OPCs are really powerful antioxidants, and she suggested that this may help with my memory problems. So I figured, well, what the heck, I'll give it a shot. After 3 days on the product, I noticed, I woke up one morning and said to my husband, you know, my leg doesn't hurt anymore. And that was really odd because it had been hurting right along, and nothing made it better. I didn't really believe it was the OPCs, so I stopped taking them. And within a few days, the numbness and tingling was back, and there's actually a lot of pain came with it as well. So I started taking the OPCs again, and all the symptoms abated once again. I'm forever a skeptic. I still didn't believe it was the OPCs, so I stopped taking them, and again the pain and numbness came back. I started taking them again, and it went away, to the point that I'm completely convinced that is what made my symptoms disappear. In the process of doing the tests for the neuropathy, they had also discovered that I had a diminished reflex in my right knee, and I had no reflex in my right foot. In October, I went back to the doctors for a routine physical, and the reflex in my knee had returned to normal, and I did have a reflex in my right foot. It was slightly diminished, but it's there, which is a lot better than it was. And I thought, I wonder if that's from the OPCs. My doctor looked over the literature and determined that I should continue to take it. In November, I went back to my ophthalmologist, who found that he couldn't believe what he saw. He said, I don't know what you're doing, but whatever you're doing, keep doing it. The retinopathy in my eye, the area that was leaking, had stopped leaking. The fluid that had pooled there, which normally takes about a year to be reabsorbed, was almost completely reabsorbed. This was after being on the product for only 6 months. I had also been hesitant to go back to the ophthalmologist because I knew I wasn't seeing well, and in 12 years, every time I went, my prescription got stronger and my vision was getting worse, and I didn't want to have to get another pair of glasses. I was just tired of dealing with the whole thing. I was right, I wasn't seeing as well. When they did the eye test, it came back that my prescription was actually too strong. My vision had improved and is where it was 3 years ago. So not only did the OPC help the retinopathy, but it's also helped remove the fluid, which has made my vision much better. My latest development is I have the very beginning of kidney disease, which is again another complication of diabetes. I was put on a blood pressure medication that the side effect protects the kidneys from kidney disease. I have been able to discontinue the blood pressure medication and still maintain the health of my kidneys by using the OPCs. My doctor doesn't know what's going on. He can't really explain it, but says to continue taking it. And if you do anything, find out what this product can do for you, because instead of dying from diabetes, I'm now living with diabetes, thanks to the OPCs.
Hello, my name is Aaron, and I've been taking the OPCs for the past 3 years of my life, and it's dramatically changed everything that I've done in those 3 years. I played water polo for the past 8 years at college and in high school, and now I play professionally in Australia. The OPCs has dramatically changed everything I've done in the water and also out of the water in academics. It all started about 3 years ago, before my first 2 weeks are known as the hardest 2 weeks of practice. We start off with 3 hours in the water morning, 3 hours in the afternoon, followed by a 2-hour dry lands running session and weights. This is very hard on our bodies. Our muscles are continually drained, and it's hard to recover in between practices. It just makes it for long days. When my father came up to me about these oligometric proanthocyanidins, also known as the OPCs, He told me a couple things. First, my muscle time would recover. Second, it would make me a better athlete, and it would also help my concentration time in the water, and it would make me a healthier person. At first, I was very skeptical, but because it was my father, I didn't want to disappoint him and make him mad at me, so I decided to make him happy and take the OPCs. After the first week of practice, I noticed some dramatic changes in my performance. I was swimming a lot faster times. My endurance times were a lot longer. I was recovering in between practices, and most importantly, my injuries in my shoulders had seemed to disappear. As a college athlete, we are often scrutinized over performance-enhancing drugs and other supplements that athletes are known to take. I was also very worried about this. But seeing OPCs are a completely natural substance, I cleared it through my athletic training staff, my coach, and had it checked out also with a physician. This is a completely natural substance, which gave me a lot of comfort as an athlete. In college, it's a lot of hard work of being an athlete and trying to balance school. There's more to college than just being a dumb jock, and I try to exemplify that as much as I can. Taking the OPCs has really helped me out in my academics as well as athletics. Getting up at 5 a.m., having 2 hours of practice, then running a 4-hour class, another 3-hour practice, sometimes weights, and then having to go back, do a research paper, study for midterms, finals, and then have a job at night to try and pay for it all is very challenging for a young adult who's very influential in his life. But the OPCs has really helped me out. It's helped me to focus in class when I was very mentally and physically tired. It's helped me focus out of class studying for class and research. And more importantly, it's helped me to become where I am today. My last year, I accomplished Dean's List and Student Athlete of the Year, as long as All-American honors in water polo and first team All-League. Over the past 3 years, the OPCs has made me a better person because it's given me the energy to do the things I want to do in my life. The things that I've wanted to do was be the best person I can, be the healthiest person I can, and make everyone have energy around me. As an athlete, I pride myself in having lots of energy and being in good shape year-round. And being in good shape year-round means having my body perform at the top level and being able to recover. This all-natural substance isn't performance enhancing. It helps my body maintain its refreshness and its muscle endurance. And it helps my inflammation and my tendons go down so I don't have problems with tendonitis anymore, and I don't have to sit out games or sit out practices, which in the long run makes me a better player. And again, the OPCs has made me a better person, a better player, and a better student.
Hi, my name is Mario, and I started taking OPCs about 5 years ago. I started taking them because I was told that it would lower my cholesterol. Well, at last check, my cholesterol has been lowered by over 150 points. This, and for that reason only, I would stay on OPCs for the rest of my life. But something else happened that changed my life. I had hip pain for 20 years, and I had been to different chiropractors, doctors, and surgeons, and they all told me that I needed a hip replacement. In 1994, I was told that I needed the hip replacement now. Not wanting to go through that operation because that would just be the first of them. There would be many more probable operations right after that. I decided to try and live with the pain as long as I possibly could and lived on over-the-counter painkillers. After being on the OPCs for about two weeks, I woke up one morning pain-free. Now, I didn't believe it was the OPCs, so I went off of OPCs, and the pain came back. So I went back on OPCs, and the pain went away. Still not believing, I went off of OPCs again, pain came back. Back on OPCs now, and I have been pain-free, and I'm doing everything I couldn't do before, such as ride my horses, skiing, racquetball, playing baseball with my son. I thank OPCs for this.
Hi, my name is Lori, and I'd like to tell you where my life was about 2 years ago. I'm in my mid-30s, and I had lifetime allergies, especially to cats, which developed to seasonal allergies and then to asthma. I couldn't walk around without my inhaler. I also have muscular dystrophy. The type I have is myotonic dystrophy, and I also had a lot of back problems. The two together made basically any kind of movement very difficult, if not impossible. I also have 3 valves in my heart that are prolapsed, and without the exercise, because of my back, I was having a lot of irregular heartbeats and a lot of chest pains. I also had a condition for 2 years with my lymph nodes. One day they were just swollen, and I had to go through different medications, many biopsies, even removal of the lymph nodes because they were swollen, and the doctors just said it was nonspecific inflammation, and they thought that it was a pre-Hodgkin's condition. I began taking OPCs because I was hoping for some relief for my back problems. Within 4 to 5 minutes of taking my first dose of OPCs, I noticed an immediate surge of energy, and I thought, wow, this is pretty neat. Within 1 week, my asthma and allergies were completely gone. I have not used an inhaler. I do not own one. I could even sit with a cat on my lap for 2 hours without sneezing. My myotonic dystrophy and my back problems have basically gone away to where I can do whatever sports I want without taking muscle relaxers or pain medications. My heart is beating much better now. I don't have so much irregularities. And my lymph nodes, I'm proud to say, within 2 to 3 weeks of taking the OPCs, my lymph nodes returned to normal size, which is something that the doctors were not able to do for 2 years.
Hi, my name is Lori. In 1986, I began to have problems with my legs. The right one would just buckle out from under me. To make a long story short, I ended up having 7 surgeries on my right knee. Then in 1999, I lost the use of my legs and was confined to a wheelchair. I had an MRI and a cerebral angiogram, and this confirmed that I had multiple sclerosis. The doctors put me on steroids, which got me out of the wheelchair. But I put on 63 pounds as the result of these drugs. I would wake up at night with terrible back pain. My headaches were terrible, and my balance was out of whack. I was put on antidepressants, and it helped to control these 2 conditions. In going up and down the stairs, I needed my husband to assist me. The fatigue was overwhelming, and I needed a 1 to 2 hour nap every day. My memory was not great. My skin was covered in psoriasis from the drugs that I was on. I was walking, but hanging on to whatever I could to keep from falling. I tried many different things to help my condition, but each time I tried something, it would help for a little while and then would stop working. Then in August of last year came the relapse that I dreaded so much. After a visit with the doctor, his advice to go home and do absolutely nothing, not even knitting, I knew that this time I would stay in my wheelchair rather than do steroids again. It was at this point in my life that I was introduced to the oligomeric proanthocyanidins. I cannot tell you how much this affected my life. It was as if I had never relapsed. The energy boost that I get from OPC is great. The back pain has gone. The numbness in my bladder has gone, which was causing some major problems. My skin is cleared up. When I used to get up from bed, I had to wiggle my feet until I could get the needles and pins out so I could walk. I don't have to do that anymore. I used to have severe muscle spasms, and that's gone. I no longer need the drugs to get me by. My memory is getting better every day. I no longer have to have my husband's support or help to push me up the stairs. Now I go up and down all by myself. And one day I even ran up and down the stairs without holding on to the rail. There are so many other things that have happened to my life since taking the OPCs, but time does not allow me to tell you everything. I just wanted to say that OPC has given me my life back. I look after my house, drive again, entertain my friends more. My life is my own. I give thanks to God for blessing the OPC to my body's use.
Well, my name is Dr. Darrell Fortson. I'm a family practice physician in the Northwest Indiana area. I've been in practice about 8 years now. And I was exposed to OPC through another physician colleague of mine who lives and works in the Washington, D.C. area. And he was telling me about this outstanding nutrient that does a lot of things for people with arthritis, asthma, people with multiple sclerosis, with chronic allergies. Now, I'm traditionally trained as a physician. I'm a board-certified family practice physician, so This was kind of a new foray for me. I usually use traditional, almost always use traditional medications for my patients and traditional treatments. So this wasn't anything that I was particularly used to doing or trying. And I gave it a try with several patients. And one of the first ones was a lady who was in her mid-50s who was on disability and crippled by severe rheumatoid arthritis. She had rheumatoid changes in her hand that were quite disabling, in her knees. She had degenerative arthritis of her neck, of her cervical spine and lumbar spine. So her neck and back were injured from her arthritis. She also had carpal tunnel syndrome, where the nerve that comes through the wrist into the hand was pinched, and she had a lot of problems gripping things and what have you. Plus she had wrist drop, where she couldn't keep her wrists up because of some of the problems that she had coming out of her neck. So she was really debilitated. And she came, at one point, we were increasing her pain medications. She was taking steroids. At one point, she was taking injections. She had had surgery, and she just wasn't getting any better. And she had come to ask if I would order a mobile device for her, like a scooter, a motor scooter for her to get around in her house and for her to do her shopping and what have you. But in the meantime, I didn't have much else to offer her. So I decided that I would try the OPC. I didn't have anything to lose. About 2 or 3 weeks after, however, she comes to the office. I'm in the office seeing patients, in a room seeing patients, and my nurse calls me out and demands that I come out immediately to see what's going on. So I come out, and I think some patient passed out in my office. Come to find out, here this lady is doing toe touches and back bends. She didn't have her cane. She had left it at home, didn't really even know where it was because she wasn't using it, had lost 12 pounds, and had the unmitigated gall to even start running. But I know that she was moving and doing things better than I had ever seen her in all the time that I had been in practice with her as her physician. And it was about that time that I really started to believe in the power of OPCs, patients with fibromyalgia, for patients with severe asthma, and I continuously saw improvements in all of them. One of them was an asthmatic patient who had a cough that just wouldn't go away. Steroid inhalers didn't work. Oral steroids didn't work. Antihistamines didn't work. Nasal steroids didn't work. Worked her up for a tumor in the bronchus or in the airway somewhere. Nothing would help until I started her on OPC. In fact, I had sent her to Mayo Clinic, and they really didn't have much to offer her until she came back and tried the OPCs. And she hasn't had any problems since. I had another patient who went through a similar rigmarole and didn't get better until they started the OPC. The third person, I finally got wise and just started them before they spent thousands and thousands of dollars. I continue to see patients with rheumatoid arthritis being improved, multiple sclerosis. People note that they have more energy. One of the most curious things is that when you look into antioxidants like vitamin C, vitamin E, you see in the literature that they're used to treat things like macular degeneration, which is a chronic, irreversible retinal disorder where the vision deteriorates in aging. People with diabetic retinopathy or diabetic eyes are also improved somewhat with antioxidants, but I've seen dramatic results with the OPCs. A patient just came into my office last week who is going blind from diabetes. He's blind in one eye, and his vision was severely diminished in the other. In fact, he had had surgery on both eyes, and it's not yet clear whether he's going to be able to retain his vision. But during the time that he was taking his OPCs, his vision dramatically improved. Again, I can't say enough about OPCs. I think for the skeptic, they need to look at the literature and see that it's legitimate, to see that it's well tolerated. I've had good results with my patients, and I take it myself, in fact, and I would recommend it to anyone as both a supplement to help them improve some of the medical conditions that they might have, or to help to maintain their health, because antioxidants are always a good idea for anyone who's concerned about their health.
These stories that you have just witnessed are not unusual stories at all. In fact, they're very representative of the people that have been using the parenthocyanidins in their lives. It's time to take a look. It's time to open up your mind and be able to receive additional information concerning your ability to maintain your own health.
When he answered the phone, he said, "I'm baffled, but I'm pleased. The dysplasia is gone and you no longer need the surgery."
Since starting OPCs, I really feel like I have gotten a lot more energy. I am no longer taking any medication for fibromyalgia.
Since now, I think I have my life back. Personally, I give a big thumbs up to OPCs.
I felt better. I could do sports. I could run. I could play outside. I could jump on a trampoline. I could skate. I could do anything.
Because instead of dying from diabetes, I'm now living with diabetes, thanks to the OPCs.
And again, the OPCs has made me a better person, a better player, and a better student.
After being on the OPCs for about two weeks, I woke up one morning pain-free.
I just wanted to say that OPC has given me my life back.
Come to find out, here this lady is doing toe touches and back bends. She didn't have her cane, she had left it at home.